So I'm John Santelli. In New York, I play a professor and chairman of an academic department. But I guess I'm here because I'm a friend of Doug's, and been for a long time. About 25 years, as many of us suggested. As an epidemiologist, I guess I've learned the value of a good anecdote. So let me tell you one. It's a little sad, but it's a happy story. On December 16th, my mom passed away. She was 92, a long illness, and that's what I was thinking about in December. And on December 19th, I got an email from Doug. I'd somehow gotten word of this from my wife, and from the mountains up in Ecuador. I don't know where he found the internet connection, Gail, but he sends me this long note about, how important mothers are, how important loss is, and how to react to that. It was totally unexpected. I didn't know my wife was sending out these messages. And then on the next day, I sent him a paper to review, which I haven't heard back from. And then on December 24th, the day after my mom's funeral, actually, I opened up the email and got that email from Daniel Halpern about what had happened on the mountain that day. So, loss is really hard. Doug was a great friend, and everyone's talked about how, every time you sat down with Doug, I used to sit down and have dinner, we always tried to figure out which conference we're going to be at so we could sit down and have that long chat, and thing the ladies are supposed to do, but us boys are not supposed to do, but Doug was brilliant. And then you talk about family, you talk about science, you talk about data questions that were totally obscure, but then you talk about how all of those things meant something about public policy. And so that's what I'm going to really miss about Doug, is those lovely conversations about science. I was looking at my email from the last year. And there were days when I would get 4 and 5 emails from Doug. And it was, sometimes it was obscure data questions, sometimes it was a big policy question. But I was telling this to Gail, every email started with, "That's a great idea. I'm so glad to hear you thinking about that." Every email started with a positive note. I wish I could be that good, but Doug was. I met Doug, I'm not sure where, but it was a conference, and all the conferences blend together. They're in a hotel somewhere. So Doug was working for CPO at the time, and he'd written some papers on evaluation of school clinics, and I was this, I think, lowly medicine guy, little pediatrician who ran a couple of school clinics, and I wasn't anybody. I didn't have any reputation. And I walked up to Doug, and it was like he put his intellectual arms around me, and that really began 25 years of conversation. So we would talk about science, we'd talk about, methodology and data, but we often talked about family, because Doug always wanted to check in. He wanted to know where your heart was as much as he wanted to know about where your science was. And he liked to challenge people, and he was stubborn, and he was precise. And that's why we loved him, because he moved our ideas forward. He moved the field forward. As Sarah said, he really created a way of thinking about how do we take all these studies and make a difference with them. And I think I met Cameron. I think Cameron was short. I went to the house. I think I was in the house a couple times, but he's grown a lot. I think Doug actually struggled with adolescence as much as you struggled with adolescence, perhaps. There's a theory in adolescent health that the trauma of adolescence, well, sometimes we think it's visited upon the adolescents, but we often think it's visited upon the parents who have to suffer with that. Although it gets better, most of us have discovered. And Doug was Doug is the adolescent expert, and I always thought of him as the expert, was clearly struggling with his own adolescence. And again, I think everybody else has said this, but Doug was really a seeker of truth. I mean, I think it's very interesting. I've been in and out of they call it the academy, out of university work. And I worked for many years for local health departments at CDC. And it's very interesting, Doug never felt he needed that. You know, he had the intellectual gravitas, the ability, the insight to say, I can set up shop anywhere. And I can think about these things, and I can do good work. He just, you know, he was a humble guy. He's a humble guy, though, that contributed enormously. He believed in science. We've all said that. But he really believed in adolescence. I mean, why did he do all this work? You know, he had a zest for life, but he really cared about adolescence. And he got up every day and really wanted to do more for the youth of the planet. By the time he got done, he was in Uganda trying to sort out the PEPFAR program and what really changed life for Ugandans. And I'm working there myself now, and his work was really helpful to us as well. Well, I'm still waiting for that review. Probably not going to get it, but you know, Doug left us so much intellectually, emotionally, that I think we're all going to be able to carry on.